welcome to this explainer. Okay, today we are diving into a medical breakthrough that might just honestly flip everything we know about psychiatry completely upside down. What if severe mood disorders like bipolar disorder actually leave a physical footprint on the brain? Today, we're going to unpack some incredible research that doesn't just visualize that structural damage, but actually shows us how to repair it. Let's get right into it. So first off, I want to pose this pretty profound question to you. Can mental illness actually be cured by physically repairing the brain? The core of our exploration today revolves around a fascinating case study. It's about a 60-year-old male patient who is suffering from bipolar disorder, and his MRI scans revealed clear, visible brain atrophy. This takes us way beyond just managing emotional ups and downs. It sets up this mystery of deep structural brain pathology that demands a real physical solution. Here's our roadmap for today's explainer. We'll start with what cytokine therapy actually is, the specific cytokines used in the treatment, the actual brain region recovery, changes in emotions in EEG, and finally, potential applications for other diseases. All right, part one, what exactly is cytokine therapy? To really understand why we need this therapy, we gotta look at the underlying problem. A lot of times, bipolar disorder is thought of as just invisible waves of mood, right? But it actually causes hyper-excitable brain waves and a physical thinning, an atrophy of the brain's cortex. And the crucial element here is a network of cells called GABAergic neurons. Think of them as the brain's inhibitory network. They're literally the chemical brakes that calm down an overactive mind. The whole starting point for this therapy is the fact that bipolar disorder involves a severe deficiency in these exact brakes. So the ultimate goal here? To physically regenerate these GABAergic neurons to restore calm and balance to the brain. Moving on to part two, the cytokines used in treatment. So to orchestrate this massive brain reconstruction, we need foremen on the job. And these are specific chemical messengers called cytokines. It's kind of like a highly specialized cocktail recipe where every single ingredient has a very deliberate job. HGF and GCSF act together to wake up and multiply neural stem cells. Then, adiponectin steps in to reduce inflammation and prep the brain's environment. And finally, BDNF acts as the finisher, maturing the synapses of these newly born neurons. Together, they act like an incredibly skilled construction crew, directing the brain's stem cells to regenerate those crucial GABAergic neurons we just talked about. Now, over a 21-month administration period, 3 unique formulations, Gabatroph EPI, Gabatroph ADPK, and Epitroph PSY, were administered daily right under the patient's tongue. If we track this timeline alongside the patient's Cognitrack scores, we see this steady, undeniable upward trend in really critical areas like cognitive flexibility and executive function as the treatment actually progressed. Part 3, Brain Region Recovery. Okay, moving from microscopic chemistry to macroscopic proof, let's look at the actual physical changes in the brain. The 3D MRI scans of the prefrontal cortex before and after treatment are absolutely wild. Before the therapy, there's this noticeable widening of the cortical sulci, which is clear atrophy. But after treatment, there is an obvious, visible reorganization and regrowth of gray matter. The brain tissue is quite literally rebuilding and repairing itself. It's amazing. And we see a really similar story in the anterior cingulate cortex, or the ACC. The ACC is absolutely vital for cognitive flexibility and executive function. Basically, it bridges emotional control and logical reasoning. Here again, post-treatment imaging confirms clear structural repair. You remember those improving cognitive function scores we just looked at? Well, this physical recovery in the ACC is exactly what was driving those improved numbers. Let's look even deeper now, right into the hippocampus, the brain's memory center. If we focus on the neck of the hippocampus, before treatment, there was specific atrophy right there. But following the cytokine therapy, that atrophy was partially reversed. Crucially, this structural fix correlated directly with the patient showing marked improvements in verbal memory. It just goes to show, when you fix the physical structure, the function actually returns. Section 4. Changes in emotions and EEG. So, how did this newly rebuilt brain tissue actually alter the patient's daily emotions? Well, looking at the P300 EEG data captured during an emotional control test, the pre-treatment data reveals these chaotic, hyperexcitable red spikes, which indicate intense feelings of sadness and anxiety. But looking at the post-treatment data, those violent, jagged waves are completely smoothed out. This is brilliant, undeniable proof that the newly generated GABAergic neurons are successfully doing their job as the brain's brakes. The really crucial metric to watch here is 10,000 microvolts squared. Before the intervention, emotional reactions were spiking dangerously high. But after treatment, the peak voltage for all emotional responses dropped cleanly and safely below this 10,000 threshold. The emotional runaway train was scientifically, quantifiably brought under control. Which brings us to what is perhaps the most incredible finding of this entire case study. 2 full years after stopping the daily cytokine therapy in 2020, the patient's normal emotional control was perfectly sustained in 2022. Why? Because they weren't just temporarily masking symptoms with daily medication. No, the brain had physically rebuilt its own infrastructure, creating a sustainable, autonomous braking system. How cool is that? Now, zooming out to look at the entire mood network, we can see exactly how this works on a global scale. The blue pathways represent the GABAergic projection neurons. With these newly regenerated inhibitory neurons effectively mapping across the limbic system, they can properly regulate the excitatory signals, which are shown in red. By repairing the foundational wiring, the treatment addressed the exact underlying pathology of bipolar disorder. Finally, Part 5, Potential Applications for Other Diseases. This dramatic case study is definitely a beacon of hope for bipolar disorder, but honestly, it's also just the beginning of a broader medical revolution. The fundamental mechanism of rebuilding damaged brain infrastructure has massive implications for other neurodegenerative diseases. In fact, the authors of this research point out that this exact cytokine cocktail approach has already shown promising results in treating conditions like Alzheimer's disease and vascular dementia. To synthesize everything we've covered today, we are witnessing a monumental shift. We're moving away from an era of merely managing the symptoms of psychiatric distress and stepping into an era where we can physically repair and regenerate the underlying brain pathology. This truly is the dawn of a new psychiatric medicine. I want to leave you with a thought to ponder. If we now possess the biological tools to literally rebuild the brain's architecture, what incurable disease will we cure next? The future of neurogenesis is unfolding right now, and it is absolutely thrilling. I really hope this explainer sparked your curiosity today, and I cannot wait to dive into the next breakthrough with you.